So today I'm at Circle Care Clinic with Dr. Shireen, who is a pediatric allergist. So that's a really specialized area of pediatrics where she deals with allergy. And if you have a child who's ever had, or you're worried that they've had a food intolerance or an allergy or eczema driven by allergies, you may think that this is someone who you should be seeing. So for me, it's really relevant because I see lots of children and younger children, like under the age of 1, with eczema or severe eczema. And the parents always ask me, does my child have a food allergy? And I never really know how to answer that question because it's such a really complicated field of medicine. So you're a specialist in oral immunotherapy. I think Dr. Shireen will tell us what that is. So just tell me a bit about when a child presents to me, for example, or to you with eczema, and the parents are saying, and it's a 5-month-old child, baby, and they say, I think our child has a food allergy because every time they eat X food, they get an eczema flare. How do you kind of deal with that problem?
Yeah, so this is a really common problem that I probably see multiple times a day. So I think, let's kind of backtrack. So kids who have eczema, so kids that you're seeing in your clinic, the answer is yes, they are definitely at higher risk of developing food allergies. But not all children with eczema have food allergies. So what we can actually do to prevent it, and I think that's kind of the first step.
Oh, like prevention. Yeah.
Prevention.
Even if they have eczema.
So even if they have eczema. So the kids, especially with moderate to severe eczema, these are the kids that you want to introduce the food early in life. And early meaning 4 to 6 months of age. So there was a really big study to come out of the UK a couple of years ago called the LEAP study. And this study actually showed introduction of peanuts to kids that had a higher likelihood of developing allergies. They divided them into 2 groups. One group ate peanut early, the other group, and early meaning around 4 months of age. Yeah. The other ones didn't eat peanut early. And so the ones that didn't eat peanut, they were 5 times more likely to develop allergies. Oh. So what we know about the immune system is the earlier the better. Okay. As long as that child is developmentally able to eat the food, feed them the food.
So basically, a varied diet.
So a varied diet. The 3 that you kind of want to hone in on, the 3 most important ones we say are dairy. Okay. So things like you can do that Greek yogurt, eggs. The eggs, you always want to introduce the egg white and the yolk together. Okay. And then things like peanut butter. So you can do crushed peanuts.
Love a bit of peanut butter.
Yeah.
So thank God I'm not allergic. So with this though, I thought that children are get all these foods through the breast milk. So if the mom eats peanuts, the child will already be exposed to peanuts.
Yes.
Is that not true? Is that true?
Yeah, 100%. So if the child is exposed to breast milk, that's why we tell moms when they're breastfeeding, eat everything under the sun. Okay. Because they do get some exposure. Obviously, it's not as much as when you're eating it physically, but yes, they definitely do get some exposure through the breast milk.
Okay, but that's so parents would restrict peanuts, for example, if they're concerned their child is going to have a peanut allergy. Is that how this works? Do all parents? I'm not a parent, clearly. Do all parents do that?
Yeah. So I think there's definitely some parents who are hesitant just because they may have an older child that has a peanut allergy, or they may be allergic themselves. But what we know is that the recommendations have changed drastically over the last 10 years. So 10 years ago, we used to say, hey, hold up, wait for that peanut, don't introduce the peanut. And it used to be egg, actually, not introducing egg until later in life. But we now know that that is the wrong thing to do.
Oh, right, okay, fine.
So introduce it early. The immune system gets used to it early. They tolerate it better. And the other thing, too, is when you introduce the food into the diet, you always have to be consistent. Okay. So don't introduce it and forget it. You're going to introduce it, but also make sure it's regularly in the diet, about 3 times a week. So once you introduce eggs, make sure it's a part of their diet.
Yellow and white.
Yellow and white.
Okay.
Yeah.
And how old are kids when they start to eat eggs?
So
I'm sure everyone knows this, but I don't.
The children that I see, maybe because I see a lot of children with a history of eczema, history of other siblings with food allergies, if they are developmentally ready, I generally recommend the introduction around 4 months of age.
Okay.
So 4 to 5 months, that's kind of the earliest time you want to do it. And the other thing too is when you're introducing an allergen like egg, it doesn't have to be a full egg.
Oh, okay.
Like they're not going to sit down and eat a full
They're not,
boiled
right? I
egg.
didn't think a child
Yeah,
would do that.
but the recommendation I give to parents is you want to kind of slice off just a very tiny piece of the egg white and the yolk. You're going to mash it into, you know, their avocado or their oatmeal or, you know, whatever other food that they're eating. So it doesn't have to
Right,
be
it's not like a
just
separate thing.
exactly. It just has to be the gut sees it.
Okay.
And that's how you develop good tolerance.
So so have you had kids who have had eczema and they came to you, parents are worried they have a food allergy, you've perhaps excluded the food and then their eczema got better. Does that happen?
Absolutely, yes.
does?
So I just had a
See, I
child.
don't exclude food, so I don't know what happens. Okay.
So I mean, excluding foods is definitely not something I would recommend.
For parents to do on their own?
For parents to do on their own, it has to be, especially in a child that has eczema, because the moment you start eliminating foods from the diet, you're actually putting that child at higher risk of developing food allergies because the immune system no longer sees it.
Yes.
So if it doesn't see it, it doesn't know it.
Yes, right.
And so what you want to do is early, consistent exposure. However, if the child comes in and they've had an issue, for example, with peanuts, eggs, dairy, the first step that we want to do is get the eczema under control. You want to make sure, you know, good moisturizing, use of medicated creams when needed. Get that eczema under control, because once that eczema is under control, it makes things a lot easier.
To see, I guess.
To see,
so you give
exactly.
them a peanut, but it's not immediate. So if they eat a peanut, their eczema is clear. Because I also actually do say this, I'm like, you can only find that out when we clear the eczema and then see if the kid keeps getting it back again. So if you clear the eczema, and then if they eat a peanut, how quickly after eating the peanut would they develop eczema again?
So, you know, if there is if there's a true IgE mediated reaction, so this is a true allergy that we're talking about.
An anaphylactic type EpiPen allergy.
EpiPen allergy. So these allergies typically appear in kids, they appear within minutes. But if we want to talk about like textbook, you know, up to 2 hours, this is when a true allergy will appear. But the way to differentiate, something that is eczema versus something that is a true allergy, usually with a peanut allergy, kids may develop hives, not only on the face, but on their trunk, arms, legs, vomiting. They may get swelling, facial swelling, and they may also have obviously severe symptoms like breathing issues.
But not eczema.
So it's
confusing.
It is confusing, but we do know sometimes if your eczema is not well controlled, you can definitely have a little bit more redness in those areas. We don't truly understand the mechanism, but we know it's not a type 1 kind of hypersensitivity reaction, as you know, we were talking a little bit about before, the type of allergy that we would worry about. We do know
like
that
EpiPen worry.
The EpiPen worry, exactly. But we do know that with these kids, when you control the eczema well, and you reintroduce these foods and there's no issues, it means that there never ever was a peanut allergy to begin with.
Okay. So, but parents shouldn't do that on their own. I think they need
Absolutely not. Absolutely not.
Don't do it on your own.
Because the problem,
don't do it on your own.
Yeah. So the problem is, it's kind of like a catch-22.
Yeah.
A lot of parents, eczema, as you know, it's a very troublesome.
Oh my God, yeah.
For the
whole family.
For the whole family, like not only for the child, right? Like it keeps, the child up at night. Hence, it keeps the parents up. No one's sleeping. A lot of itching going on. Just a lot of mood disturbance, and so. A lot of times parents are really, really desperate to try to find anything, anything that's going to help. And so, you go on to a lot of these blogs online. When I eliminated this from the diet, this happened to my child, and the problem is not every child is the same. And not every child is the same. But I always tell parents, please do not eliminate anything from the diet unless you've seen a specialist who has diagnosed you with an IgE-mediated allergy, a true allergy, because that's a whole different ballgame.
Yes, okay, fine. Because food exclusion, especially for a child, or an infant, that can affect their growth, their development.
100%. So one of the common things I see here, and I used to see a lot back home as well, is the sensitivity testing, or even the food panel testing, where people will go and they will get a blood test for their child.
Or their hair.
Or the hair, yeah.
These are called, what are they called? Dutch tests?
So in Canada, we just call them intolerance testing.
Oh, right.
But
okay, because adults do it here too. So I think it's called like Dutch test. I don't remember, but it's yeah. You send your hair off, and they tell you what foods you're allergic to.
your hair, for the kids, it's actually like they more so do the blood test.
Blood test. Yeah.
So, and I've seen this a lot. I have patients come to me and they have 22 foods that they're positive for, and 22 foods that have shown up that are high sensitivities in the test. And what happens is the parent then tries to eliminate these 22. So imagine trying to eliminate dairy completely from the diet, eggs completely from the diet, right? And so it's almost that's a lot of work. That's a lot of work.
Yes.
Not only is it a lot of work, but number one, that's a lot of micro and macronutrients that you're depriving that growing child of. And number two, it's frustrating because this child will go to a birthday party or will go to, wherever and will not be able to eat what other kids are eating
for them. Yeah.
Right. So I think, for parents, let's normalize eating for our kids. Let's introduce them to these allergens, introduce them early. If they have eczema, go see someone about the eczema. Mm-hmm. Make sure the eczema is under control. Please do not do any of these testing. Like the blood test or the hair test.
Because there is no test. The test is taking the food away and seeing what happens.
So the test is, we always say the gold standard in allergy is what we call an oral food challenge.
Oh, yeah.
Is I give you the food.
And that's oral immunotherapy.
So that is where oral immunotherapy comes into play. So oral immunotherapy is a very fancy term for basically just actually eating the food in a very, very small calculated dose. So it's calculated by, either the doctor or the pharmacist, and you basically gradually increase that dose over time. And what you're trying to do is you're trying to reteach your immune system how to start tolerating that food. Okay. So that is oral immunotherapy.
So you don't do skin prick testing?
So I do skin prick testing. Skin prick testing is probably the go-to test in children. So we do it, older children, we do it on the arm. Younger children, we do it on the back. Obviously, you have to be antihistamine free for 5 days in order for the test to work. But skin testing is very sensitive. So it's not a specific test, but it's a very sensitive test. Okay. So if your skin test to a food is negative, that is a very high likelihood that you're probably not allergic.
Okay. But if it's positive?
So if it's positive, the other thing too is it can be positive if you have sensitive skin, like in eczema. So that's why your eczema has to be under control. Because if I do it like right here where your eczema is flaring, I'm going to get a huge positive result. So skin testing is not, it's not a perfect test, but it's pretty accurate. Okay. But the problem too is that you can get false positives. So I will never, I have a rule of thumb. If a child is eating the food and they're tolerating the food, I will never do testing because there's nothing on the clinical history to suggest that they may have, an allergy. So only if there's an indication to do the test will I do skin testing, because you can have false positives and you have to know how to read that. Because I've had children who have eczema. The parents really, really want the testing. We do the test for that peanut, for that egg. It's borderline positive, but I say, hey, you know what? I'm going to get you guys to come in. We're going to give you a very tiny amount of the food, and most of them do pass the test.
Okay. All right. Well, that's cool and very interesting. And I didn't know a lot of that myself, so that always educates me. But getting the eczema clear is the first step.
100%.
So we can do that. I'm sure you can do that. We have great medications and treatments for eczema. So no child should be suffering with eczema, because we can absolutely manage it, whether it's a food intolerance driven type allergy causing the eczema, or if it's just normal eczema. We have great treatments for that, and there are really good ways to figure out if your child actually does have a food allergy. So cool, that's awesome. Thank you so much.
Yeah, thanks for having me.
Telling me all that information. Telling us all that information.